Hey everybody, I'm Sam.
I'm Zach.
I'm Brianna.
I'm Linnea.
And the topic we chose for our hypothetical research study is the effects of mirror neuron therapy on autism spectrum disorder. Autism spectrum disorder is primarily characterized by difficulty socializing with others and repetitive movements or behaviors. According to the DSM, here is how the disorder is categorized. For level 1, which is high-functioning autism, the individual needs support, and the patient's social and communication skills and repetitive behaviors are only noticeable without support. For the second level, the individual needs substantial support, and the patient's social and communication skills and repetitive behaviors are still obvious to the casual observer, even with support in place. And for the most severe level, level 3, individuals need very substantial support, and the patient's social and communication skills and repetitive behaviors are severely impairing their daily life. Since autism spectrum disorder is on a spectrum, individuals with this disorder may experience more or less severe symptoms than others with the same diagnosis. While there is no cure for autism, symptoms can be improved greatly through various forms of therapy. A therapy technique that has recently gained research attention is mirror neuron therapy, which works to activate the mirror neuron system, which is responsible for imitation, empathy, and emotional understanding. Our study seeks to analyze the effects of mirror neuron therapy on autism spectrum disorder. The ability to effectively socialize with others is crucial in successfully navigating the world. During socialization, several different areas of the brain become active. These areas allow individuals to comprehend what is being communicated to them while also contemplating and delivering adequate responses to others. Over the last few decades, researchers have become aware of the mirror neuron system, an area of the brain previously unknown to aid in socialization. Humans have millions of mirror neurons which work in conjunction to create the mirror neuron system. When watching an individual perform an action, the mirror neuron system activates as if the individual who is observing is the one performing the action. The mirror neuron system is therefore involved in key behaviors like imitation, empathy, and emotional understanding. While empathy and emotional understanding are esteemed traits within society, some individuals have difficulties achieving these qualities because of differences in their biological makeup. Individuals with autism are one segment of the population known to fit this category. Although autism can impact an individual in several ways, one of the most common symptoms is difficulty socializing with others. Autism can affect one's ability to read emotions and express empathy, both of which play important roles in understanding and being understood by others. Even when an individual can comprehend spoken language, an inability to read the emotions underlying speech will likely inhibit that individual's ability to communicate effectively. Given that autism affects empathy and emotional understanding, it is possible that the mirror neuron system plays an integral role in understanding and treating the symptoms of this disorder.
Studies have shown that the mirror neuron system is only the first level of understanding others and their emotions, however. According to a 2018 study, simple action observation supplies two kinds of information: the goal, which is the action, and the intention, which is the why underlying it. An example of this would be if someone was picking up a glass of water because they are thirsty. The goal is picking up the glass of water, and the intention is because they're thirsty. Children with autism spectrum disorder have difficulties recognizing action and intention, but no difficulties with goal identification, suggesting they rely heavily on motor behavior cues in order to draw meaning from actions. By combining one's level of cognition with their emotional ability level, researchers have been able to estimate more specific measures of empathy. This measure can then be combined with social-emotional and behavior tasks, as discussed later, to assess individuals with autism spectrum disorder overall ability to understand and display emotions. Numerous studies have examined behavioral links between the mirror neuron system dysfunction and autism spectrum disorder, suggesting that enhanced activation of the mirror neuron system in individuals with autism spectrum disorder could improve empathy and emotional understanding. As research has progressed, several different tasks have been developed in an attempt to activate one's mirror neuron system. Many of these tasks have been shown to successfully activate the mirror neuron system, leading researchers to then treat a variety of clinical disorders in which emotional understanding is impaired. Although specific task instructions differ among researchers, they tend to target two main elements: socio-emotional functioning and motor behavior. Socio-emotional tasks work to improve individuals' ability to recognize others' emotions, while motor behavior tasks help individuals appropriately express emotion in response to others. These two elements are greatly interrelated and make up some of the primary symptoms of autism spectrum disorder. To test socio-emotional functioning, studies have analyzed individuals' mirror neuron activity while performing tasks such as inferring others' thoughts, feelings, and beliefs. A study in 2018 showed that for adults with ASD, the mirror neuron system is less active when performing socio-emotional tasks. Additionally, individuals with higher levels of autistic traits generally had less mirror neuron system activity in their right cerebral hemisphere, whereas activity in their left cerebral hemisphere correlated with poor task performance, but not with level of autistic traits. In another study analyzing socio-emotional functioning, individuals with ASD were faced with the task of correctly differentiating between various facial emotional expressions. In this study, individuals with higher MNS activity in their premotor cortex performed better when differentiating between static faces, but there was no difference in performance when participants were shown dynamic faces. This may suggest that the mirror neurons process simple socio-emotional information better than complex information.
When comparing the mirror neuron system activity of typically developing children with autism spectrum disorder, there are several notable differences. During emotional imitation tasks, which require both socio-emotional functioning and motor behavior, children with autism showed activity in their visual and motor cortices, but no activity in their mirror neuron system. In facial expression observation tasks, which are primarily socio-emotional in nature, neural activity was stronger in typically developing children than those with autism. As illustrated in the previously mentioned studies, mirror neurons seem to have different specialties depending on which area of the brain they're located. This may explain why typically developing children rely more on the right cerebral hemisphere to imitate and observe emotions than children with autism. The right cerebral hemisphere is also more directly linked to one's emotions, which likely leads to better empathetic understanding for typically developing individuals. Since those with autism do not have as much mirror neuron activity in this hemisphere, they must learn to develop different strategies to accomplish what comes naturally to typically developing individuals. Children with autism use their visual, premotor, and motor attention to decipher emotions, which are not as closely linked to their own emotion systems. This suggests that while important, atypical mirror neuron system activity does not completely explain all mentalizing difficulties associated with autism.
Given that autism spectrum disorder correlates with the mirror neuron system in a variety of socio-emotional and motor abilities, it may be valuable to investigate whether people with autism can benefit from participating in longitudinal mirror neuron therapy. Mirror neuron therapy has been used to treat stroke patients by activating the mirror neuron system to mimic motor movements. The purpose of this hypothetical study would be to test whether individuals with autism spectrum disorder can be taught emotions by activating their mirror neuron system, similar to how stroke patients have been retaught motor movements. We, the researchers, hypothesize that individuals with autism spectrum disorder will have increasingly more mirror neuron activity following each mirror neuron therapy session. Along with these improvements, they will also experience an increase in their ability to interpret and express emotion after repeatedly participating in socio-emotional and motor behavior tasks.
Look at methods. We decided that we wanted to have 45 individual participants, and all of them are on the autism spectrum disorder. They varied in functioning level, however they had to have a high enough functioning level in order to successfully participate in the study. This was determined by talking to either their social worker, their legal guardian, or behavioral therapist to determine if they were able to successfully participate. All of the participants were ages 18 to 35, and they were reached by the researchers by contacting different organizations around the La Crosse area, such as Aptive and Catholic Charities. Materials. The researchers required the materials for the static dynamic emotional recognition task and the motor behavioral task. For the static dynamic emotional recognition task, we needed 20 different actors who were willing to make fear faces and surprise faces, as shown below. These actors had to make static pictures and dynamic pictures, videos of these different emotions. The action observation therapy, these actors were also required to complete various simple actions, such as pouring a glass of water, in order for the participants to imitate. Each time a participant completed this task, they went through 30 trials. This way they did not see the same pictures every time they came in. Performance was measured by the participants' accuracy in distinguishing between the two emotions. For the motor behavior task, participants were asked to carefully watch videos of people completing different actions, such as patting their head, and then participants were asked to perform these actions. Their performance was measured by accuracy in repeating these behaviors. If our hypothesis was supported, then the participants would have overall improved scores. This would mean that the average from the first session to the last session would be improved. In addition, they would improve from session to session. If this is the case, the results would have supported past research by showing that the mirror neuron system is partially responsible for emotional understanding, which is a primary symptom of autism spectrum disorder. This would also show that mirror neuron therapy used to help stroke patients can be extended to teach individuals with autism spectrum disorder emotional understanding. If our results were not supported, this would mean that the scores did not improve. These results would go against research showing that the mirror neuron system is connected to emotional understanding. This would also mean that mirror neuron therapy that have been used to help stroke patients cannot be extended to teach individuals with autism spectrum disorder emotional understanding.
Limitations to this study include possible errors in participants' baseline functioning based on information received from their social worker, behavioral therapist, and/or caregiver. These people may have varied in their ability to determine if participants were able to successfully participate in the study. The tests used for this study could be of concern as well. The overarching goal of this study was for participants to be taught these social-emotional skills, but the tasks used were mainly test and result-based and may not prove to be effective in actually developing the skill. Many participants were also taking psychotropic medications, which have been shown to increase cortical excitability and could alter results with heightened performance on tasks. For future research, it may serve better to have participants self-report their baseline functioning instead of determining it by the above tasks. This has its own flaws, but may present itself more accurate than determining baseline functioning from secondary sources. Additionally, 3 weeks is a shorter period of time for longitudinal study, and doing future studies with longer periods of time could strengthen results further. Some participants may require more time in therapy to increase improvement, and some may benefit from meeting more frequently than 3 times a week. Also, using more teaching-based tasks may lead to better outcomes for participants rather than using test-based tasks, although such tasks may be difficult to develop considering this is a newer field of study. More participants should be recruited to compare results across the conditions to determine which combinations of baseline reporting, study duration, and task type yields the most promising improvements for individuals with ASD. It would also be interesting for future researchers to study people with ASD with varying functioning levels to see if they are affected differently by different types of therapy. If the study's results supported our hypothesis, it would mean that not only would the participants perform better at these tasks, but that those with ASD outside of the study could possibly implement mirror neuron therapy in their lives and improve their social communication skills. This could have massive implications for people with ASD, and as their interactions with others may be more successful. They may have more opportunities available to them in the form of jobs, activities, education opportunities, and independence or housing options. Had the hypothesis not been supported, more work would need to be done to determine the effectiveness of mirror neuron therapy on participants with ASD, and possible changes to therapy in order to show a difference in performance. Whether the study was supported or not, research in this area is limited, and replications of the study must be done to increase reliability and show that those with ASD could in fact learn and interpret emotion at a higher level. The increased activation of the MNS in the brains of the participants over sessions tells us that the MNS was responsible for abilities dealing with these emotions.
Thanks for listening to our hypothetical study.
We hope you enjoyed our video.
We hope you have a good rest of your day.
Bye-bye.